A hospital stay can be pretty intimidating. You're surrounded by all these unfamiliar sounds, procedures, and people. But behind all that, there's a really carefully planned journey designed to get you well. So today, let's pull back the curtain on the world of acute care and follow a patient's entire journey from the minute they arrive to the moment they head back home.
So just think about it for a second. What really makes it work? Is it just the high-tech medical gear and the life-saving surgeries? Or is there something more? We're going to dive into the critical and often unseen work that makes sure a patient is not only physically safe, but also comfortable and treated with dignity. And that feeling of comfort, it starts the second a patient walks through the door. This first stage of their journey, the admission, is all about creating a sense of safety and calm in what can be a really stressful situation. What's so interesting here is how simple these steps look on the surface, but their impact, it is huge. A warm hello, a quick tour of the room to show someone the call bell and how the bed works, giving them a little bit of control, and treating their personal items with respect. This isn't just about being polite. This is the very first step in building trust and actively calming a patient's fears. Okay, so once the patient is settled in, we move on to the next phase, getting them ready for a physical examination. This is where a caregiver's skill in helping with the medical stuff while always protecting the patient's dignity really comes into play. Let's break this down. Before the exam, it's all about getting things ready, making sure the space is private and all the right tools are on hand. During the exam, the focus shifts to support, making the patient feel at ease and helping the examiner. And then after, it's all about getting back to normal and comfortable as fast as possible. This whole three-part process makes the exam go smoothly, efficiently, and with total respect for the patient.
Now, part of getting ready means grabbing the right equipment. And I get it, a tray full of tools like this can look a little intimidating, right? But every single one has a very specific job. Let's just demystify one of the most common ones real quick.
Right, the ophthalmoscope. Think of it like a super specialized flashlight mixed with a magnifying glass. It lets a doctor see all the way to the back of the eye, the retina, the optic nerve, all that stuff. Just knowing what these tools are can be another small way to make a patient feel a little less anxious.
And this is where the art of draping becomes so important. It doesn't matter what position the patient is in, whether they're lying flat on their back, in the lithotomy position, or on their side. The whole goal, the number one priority, is always the same: keep them warm and protect their privacy by only exposing the small area that needs to be examined. You might hear this term thrown around, the lithotomy position. It's a specific position used for things like pelvic exams, and it's designed to give the doctor the access they need, while a caregiver uses a drape to maintain as much privacy and dignity as possible. All right, let's move on to the next major step in this journey, because for a lot of patients, that journey includes surgery. And that, as you can imagine, brings its own whole set of worries and preparations. And this quote, wow, it just perfectly captures what a patient is feeling. It's never just one fear, is it? It's this whole mix of them. Fear of the unknown, fear of the pain, fear of what the doctors might find, and fear of how their body and their life might change after. Dealing with that is just everything.
And that's exactly why prep for surgery has two sides, and they are both absolutely crucial. On one hand, you've got the psychological care, really listening to the patient, reassuring them, and just being there for them. And on the other hand, you have the physical prep. That's everything from skin and bowel prep to making sure the patient is NPO, nothing by mouth, which is super important for anesthesia. A caregiver has to take care of both the mind and the body.
Okay, so the surgery's done. Now comes what might just be the most critical part of this whole thing, the post-operative period. This is where being extra vigilant is the key to a safe and successful recovery. And believe it or not, that watchful care starts before the patient even leaves the OR. The room is prepped, almost like a stage set, to make sure the transition is seamless. There's a special surgical bed with the sheets fan-folded back to make moving the patient easier, and all the gear they might need is right there, ready to go at a moment's notice. The second that patient arrives, the caregiver is the first line of defense. They are on high alert, constantly watching for these red flags. Any sudden change in vitals, any trouble breathing, or way too much bleeding. That's not just a small thing. It's a massive warning sign that the nurse needs to know about immediately. But it's not just about reacting to problems, right?
A huge part of post-op care is about preventing them from ever happening. And one of the biggest dangers after surgery, especially when you can't move around a lot, is blood clots. So what do we do about it?
Well, the strategy is kind of like a three-pronged attack to get that circulation going. First, you get the patient up and walking around as soon as it's safe. Second, there are specific leg exercises they can do right there in bed. And third, they use these special compression stockings. You might hear them called TED hose to help keep the blood moving. It sounds simple, but this trio is incredibly effective. Of course, recovery is also about helping the body get back to business as usual. So that means everything from helping with hygiene like bed baths and oral care to slowly reintroducing food and fluids, keeping an eye on urination, and guiding the patient through deep breathing exercises to keep their lungs clear and strong. All right, we've navigated the tricky parts of recovery, and now we're at the final leg of the journey, getting the patient ready to head back out into the world. And the journey started with a warm, compassionate welcome, and it ends with a really supportive farewell. The caregiver's role at this point is just to be a positive and encouraging presence, helping the patient pack their things and celebrating this huge milestone with them. It really brings that whole circle of care to a close. Now, we always hope the whole process is smooth sailing, but you have to be ready for the unexpected. And in an emergency, the plan is simple but so important. The number one rule always is stay calm. Then call for help, stay with the patient no matter what, and then help the medical team however they direct you. It's all about staying composed and taking clear action. And all of this really brings us right back to where we started. When you trace this entire journey, from those nervous moments when a patient first arrives to the hopeful ones when they leave, what you realize is that while the technology and the medicine are vital, the constant, steady presence of a calm, compassionate, and competent caregiver, that is what turns a scary ordeal into a real journey of healing.